The liver is the heavy industry of the human body. It produces and detoxifies everything that we need and everything that we do not need, respectively. Therefore, when the liver malfunctions, eventually every system in the human body malfunctions. There are classical symptoms that are associated with liver damage. The most classical of those is the one by which there is yellow pigmentation, yellow color on the skin and the sclera of our eyes. This is called jaundice. As the degree of the liver disease progresses, the liver, which is smooth and soft in our abdomens, becomes hard, and the blood that needs to go through the liver finds significant resistance. That can lead to the buildup of fluid in the abdomen, which sometimes can be quite significant and accumulate liters of fluid. We call that ascites. Or in one of the most severe complications of the chronic liver disease, which is the rupture of one of these veins inside our gastrointestinal tract, most commonly at the junction of the esophagus with the stomach, and the development of internal hemorrhage. Fluid can accumulate in the ankle of our feet and higher up, and it is not uncommon that patients experience alterations in their sleep pattern or their degree of their concentration, a condition that we call hepatic encephalopathy. The extreme manifestation of this condition is what we call hepatic coma. All patients with chronic liver disease will experience fatigue and weakness that will make them unable to function as normal human being with their daily duties. It depends on the etiology of the chronic liver disease. These universal symptoms can sometimes accompanied by symptoms related to the cause of liver disease. A liver biopsy is a small interventional procedure by which we take a little piece from the liver in order to examine it under the microscope. It is the most important, often investigations that we perform to assess the nature, but also, and most importantly, the degree of the liver damage. A liver biopsy is performed most commonly by a radiologist through a small cut in a patient's tummy and the insertion of a needle which removes a small cylinder of liver tissue for examination under the microscope. Liver transplant is the ultimate and most effective treatment for patients with chronic liver disease. When a patient's chronic liver disease has progressed beyond a certain stage, then the only solution is for that liver to be removed and replaced by a new liver. This new liver most commonly comes from a diseased organ donor, or less frequently by a close member of the family of the patient, whereby we remove part of a liver from a healthy individual to replace the diseased liver. In every occasion, we remove all the diseased liver and we replace it with a healthy graft. This is a very complex operation which involves removal of the previous liver in a very hostile environment, which is often characterized by very thin and very enlarged vessels as a result of the chronic liver disease. A patient with liver disease can maintain his liver throughout his life following careful management and following instructions by a specialist doctor. There are, however, situations where all medical treatment fail to halt the progress of liver disease. The liver becomes progressively smaller, stiffer and harder, and the patient starts to accumulate complications of the chronic liver disease, and as the months and the years go by, the liver starts to failing to perform even the basic of its functions. When a patient reaches a point where the liver reserves have been exhausted, then we know that without a liver transplant, his or her survival is limited to sometimes weeks or months. This is the time when the patient should be referred to a specialist center to be assessed for liver transplantation. We have to understand that liver transplantation is a highly complex surgery. Since its inception in the early 60s and its experimental almost performance through to the late 60s and early 70s has always been viewed as a formidable operation. It has been said that perhaps liver transplantation is the most complex operation ever invented. But we've come a long way. Today, liver transplants can be performed safely in highly experienced centers by highly experienced surgeons with results and outcomes that are considered to be exceptional. There are, however, problems, or there might be problems, and these derived from the complexity of the operation itself, which involves removing a diseased liver in a very hostile surgical environment characterized by very enlarged thin vessels as a result of the chronic liver disease, and often within a patient that has suffered the full spectrum of manifestation of chronic liver disease. Often the kidneys are not in the best of their condition. The heart or the lungs might be also suffering from the chronic liver disease. A patient that comes to transplantation for chronic liver disease is often characterized by a condition by which the blood is very thin and not often clots satisfactorily. All these situations can sometimes provide significant problems during the transplant surgery. And although one might have said that transplantation is a highly sophisticated replumbing, the complications from the various joining that we do can sometimes have detrimental effect. In addition to all the above, we must never forget that we put in a patient's abdomen a foreign body, which is the graft that has been retrieved from another human being. And the complications that can arise from this effect alone can sometimes affect the outcome of the transplant surgery.